Well, there are two main types of urinary incontinence, regardless of gender. That's stress incontinence and urgency. Should I be looking at you?
Yeah, look at me.
That is stress incontinence or urgency incontinence. And the women are much more susceptible to stress incontinence than men because of their anatomic susceptibility to pelvic floor disorders and pelvic floor damage. So women through childbirth tend to have a higher frequency of pelvic floor disorder than men. So what makes women more susceptible to pelvic floor disorders is, well, just their exposure to pelvic trauma through childbearing. Women who haven't had vaginal childbirth and those types of things aren't really as at risk for stress incontinence or pelvic floor disorders as women who have had childbirth.
With stress incontinence, what would you say the key issue is? What do you see anatomically that helps you decide what to do?
Well, really the classic presentation of stress incontinence associated with pelvic floor disorders in women is a lack of urethral support. And the way I like to describe it is that the pelvic floor muscles and the continence mechanism, they need to be in the right place at the right time. And so what happens is that through weakening of the pelvic floor supports and the ligaments and the muscles, whenever there's a stress from coughing or lifting or sneezing, there'll actually be a displacement of the muscles and the supports. And so now the urethra, which is much shorter in women than in men, so there's less resistance, will have the continence mechanism will not be able to keep urine back because it's not in the proper position to provide that support against the abdominal pressure. So from a reconstructive or reparative standpoint, from a surgical standpoint, our goal is to reapproximate and sustain that urethral position so that when women cough or sneeze, their urethra and then their natural pelvic floor muscles can and their natural continence mechanism can work properly.
The
other type of incontinence is overactive bladder associated with an urgency incontinence associated with overactive bladder. And the statistical incidence of overactive bladder type symptoms and pathology is relatively similar in men and women. Where there's a big difference is that women are much more likely to develop overactive bladder wet or urge incontinence associated with their overactive bladder. Men tend to have more frequency and a urinary urgency without leakage. So the reason that occurs is simply because men have a prostate and their continence mechanism is different than in women. So women are much more likely to get to a point where the overactive bladder forces urine out before they're able to get to the bathroom and empty. Well, there's a number of different risk factors for overactive bladder. In a lot of situations it's generally idiopathic, but certainly hormonal changes, changes from a history of childbirth again, which causes pelvic trauma, and a change in pelvic nerve innervation can cause damage to or changes in the bladder kind of feedback mechanism, the reflexes of the bladder. So women who have had a history of pelvic trauma can also be at higher risk for overactive bladder. Obviously spinal cord injury or any other neurologic disorder. Cystocele or any sort of pelvic organ prolapse is going to cause anatomic changes that are going to cause functional changes in the way the bladder works, the way the bladder reacts with other and interacts with other organs, and certainly is another common risk factor for having overactive bladder. In addition, a woman's disposition to having pelvic floor prolapse and dysfunction can lead to problems with bladder emptying, which also alters their continence, their bathroom habits. It can affect their overactive bladder and increase their risk for incontinence, and also for urinary infections and other complications from improper bladder emptying.